Okay, everyone. So welcome to our session today on diabetes during the time of Ramadan. And last year, we had the great pleasure of having Dr. Fauzia Moyeen present to us about the session. And we actually, I think, had it closer to the end of Ramadan. And we decided the following, we need to have this earlier because the information was so valuable. And it's such a pleasure for me to introduce Fauzia to you. She is an internationally, um, she's an international medical graduate, like yourselves, and a member of AIMGA. But what I want to say about her is when I met her, she's so knowledgeable with regards to diabetes and really is an expert in this area. And I know I've reached out to her myself to ask questions on behalf of family members and so on. But let me tell you a little bit about Fauzia. Fauzia has really done sessions, a variety of teaching sessions, train the trainer sessions, worked with a variety of healthcare providers, physicians, and other allied healthcare professionals to instruct them on diabetes. She's an expert in insulin pumps and has really traveled, around the world, and is also a member of Diabetes Canada for the Calgary chapter and director. So I just want to welcome you, Fauzia. If I have missed anything, please feel free to add, because I know that you have a lot of accomplishments and a lot of have done so much great work, in this area. So welcome and thank you.
Thank you so much, Dietary. And I think my introduction as being a member and one of the CTP cohort is more than enough, because starting with AMGA and getting all the guidance when I came to Calgary and joined AMGA, it was such a wonderful experience, guidance, the right pathway that we were given for transition, for residency. So thank you again for doing so much work for all the IMGs that you are doing at AMGA with all the team. So I really, this is my pleasure when I come back and I give to my fellow colleagues something. It is like extending the work that AMGA is doing. So thank you for having me on board. And thank you everyone who has joined us. And on behalf of myself and AMGA, I would like to greet all of those who will be observing Ramadan, a very happy Ramadan, which is about to start. So being our physicians, we are always challenged when Ramadan is coming. And we would like to exactly know what are the guidelines saying about Ramadan and how shall we proceed, how shall we move forward and help our people with diabetes with all the information that we can give them. So here I'm going to talk about the Ramadan, a little bit of Ramadan background. It is the 9th month of the Islamic lunar calendar. The duration varies in countries. It also varies. The fasting could go from 16 hours to 19 hours, depending on which part of the world we are in. And it is a fasting that is a complete abstinence from food, drink, and everything from sunrise till sunset. So it could be 16 hours, 14 hours, 19 hours, where we do not take anything, not even a sip of water. So Ramadan is a very different month as compared to the other months. Why people with diabetes and why Ramadan, we talk so much about people with diabetes in Ramadan, because a lot of studies, EPIDR study was done, and then it was CREET study, and CREET study showed that if we look overall throughout the world, 94% of Muslim diabetics, they fast. And out of those 94%, uh, 67% fast continuously for 15 days and 32% fast less than 15 days, but they do fast out of 29 days, they fast for more than 15 days. What really happens in Ramadan is the eating sleeping cycle is totally changed. Now, the eating habit change, our mealtime change, our pattern of meals change, the calorie intake is totally changed, and there is increased postprandial physical activity during the night after iftar and after Tarawih. And Tarawih is basically the prayer that we do. And if we perform Tarawih in the proper way, it is a complete exercise for the person with diabetes who is fasting. Now, this is a very beautiful diagram that I really like. It is the changes in feeding pattern and energy intake during various fasting periods. There are people who are fasting Ramadan, which is complete abstinence from food and drinks from sunrise to sunset. And there are some people who do intermittent fasting, and there are some people who do prolonged starvation fasting. So what really happens is, we are just going to talk about Ramadan fasting. If you can see that from early morning till evening 6 p.m. in Calgary, it will be starting from, I think, 8:30 p.m. We will be finishing at 8:30 p.m. So look at the amount of food that we take and look at the blood sugar variation. So this variation is something that disturbs the whole diabetic balance or sugar control of people who are observing fasting. This comes with the pathophysiology of fasting in diabetics, that there is less glucose, there is less insulin. So the stimulation of glucagon from the hepatic cell increases, and then the glucose output into the bloodstream goes, and it helps the muscles and it helps the body to carry on a prolonged fasting. When we talk about glucose target in range or glucose in range, which is two new concepts that we are talking now as diabetes specialists for our people with diabetes, is we look into the sensor graphs. We look at continuous glucose monitoring. And since I think year 2006, I was in Saudi Arabia, and I was very lucky to be heading the intensive insulin therapy unit, where we did Ramadan study, and we used glucose sensors before Ramadan in the month of Shaban. We used it in Ramadan, and we used it post Ramadan to see how people with diabetes with different treatment modalities responded to the change of diet, change of sleep, and change of medication during Ramadan. And again, this continuous 288 readings per day graph shows that during the month of Ramadan at iftar, we have a very high peak of postprandial glucose. And as physicians, we all know this very well, that postprandial hyperglycemia leads to micro and macrovascular complications. So postprandial hyperglycemia is very dangerous for our people with diabetes. If we look in general or as a whole, the effects of fasting in Ramadan, it is on physical and mental well-being. Now, lifestyle changes, we know our sleeping schedules change, our meal plans, physical activity, again, reduction of smoking, or those who are addicted to smoking or taking caffeine in the form of coffee, they have a severe problem in the first few days of Ramadan. And here, I would like to encourage you all to teach your people with diabetes to cut down on smoking and caffeine or whatever drinks they are used to. Cut them down from the mid of Shaban, like 10-15 days earlier before Ramadan, to start cutting down on smoking and caffeine intake, so you enter Ramadan without having any mental irritation, mood irritability, and lethargy. Physical and mental benefits of fastings, there are a lot in which we have a sense of fulfillment, a great sense of empathy towards the less fortunate, a great sense of community and opportunity to strengthen relationships. In COVID, it is going to be a little challenging, but this is how Ramadan is, that we share, we care, and we go more into meditation. However, there is sleep deprivation, and the sleep deprivation and disruption of circadian rhythm also leads to increased fatigue and reduction in cognition. Glucose excursions causes a feeling of unwell, great feeling of lethargy. These things will only happen when you do not, with diabetes, you do not plan your fasting properly. That is something that will lead to the adverse physical effects. However, if you plan properly, the fasting of Ramadan with diabetes or any other chronic complication will not create this much problem. So, as clinicians, what are the challenges that we face? Number one, we have to check the eligibility of the people with diabetes to fast. This is the most important one. Manage risks associated with fasting, adjust diet, exercise, and drugs, and counsel for monitoring of self-glucose at home. These are the four pillars which, if we properly build the Ramadan status on these four pillars, our people with diabetes will get the best benefit possible. So coming to the guidelines, so what does the guideline says concerning the eligibility of patients to fast? Now, DAR and IDF, International Diabetes Federation, and DAR has worked with a lot of, I think there are more than 20 plus Islamic countries, and the scholars, Islamic scholars, the top-notch endocrinologists, they all have come together to make the guidelines which will be shared throughout the world. And it is for us as physicians to take the guidance, but to individualize our patients. Please always remember, guidelines are there to guide us. But when it is for us to individualize, we have to look at our patient first and see what they need. The new idea of DAR risk stratification. Now, in this one, we had a lot of discussions. The previous guidelines of DAR said very high risk patients, high risk patients, moderate risk patients, and people who can fast with, they can fast easily. This year, they have given the risk stratification. And in this risk stratification, what they have done is they have said that score 0 to 3 is low risk. Now, if you go back and see type 1 diabetes, they have risk scored them as 1. However, in all the previous guidelines, type 1 people were very high risk people with diabetes to fast in the month of Ramadan. Now, this time they have put them in a low risk group. Why? If we do proper risk stratification, so the people who have stable diabetes, they will enter the month of Ramadan and they can fast. However, they have to follow certain SOPs. So this time they have put type 1, which was very alarming as physicians for us, but they have given certain words, so it was relaxation. So the low risk is 0 to 3 point. Then the moderate risk is from 3.5 to 6 points, which is on medications and strict monitoring. And then we have the high risk, which is more than 6 points, and they should not be fasting. So let me go back to the old guidelines. In old guidelines, they said very high risk are patients with grade 3 renal failure, type 1 diabetes, pregnant females, young children, people who do strenuous physical activity outdoors, like labor work. These are very, very high risk group. People who have brittle diabetes, who cannot feel their sugars going down and they suddenly collapse with hypoglycemic attack, they should not fast. People who have got unstable diabetes 3 months before Ramadan with a higher HbA1c, they also should not fast. They are very high till moderate. So I am explaining all the high risk groups to you as per the previous guidelines: old age people, people with unstable diabetes, pregnant females, young children, grade 2 to grade 3 renal failure cases, cases who are on depression medications, cases who are on immunosuppressant medications, they all should not be fasting in the month of Ramadan. Those people who are very stable, either on insulin, on oral glycemic drugs, whose medications have not been changed a month or 2 months before Ramadan, these are the people who can fast easily. People who are only on diet and exercise can fast easily. So then comes the risks. So how to manage the risks which are associated with Ramadan fasting? These are four things as physician we really look into. Hypoglycemia less than 70 milligram or less than 3.9 millimole per liter of blood glucose any time of the day during fasting. Hyperglycemia more than 16.7 millimole per liter or more than 300 milligram per deciliter during fasting any time of the day. If there is dehydration and thrombosis, we all know dehydration causes thickness of blood. Dehydration causes thickness of blood, which causes thrombosis. Retinal vein occlusion. Many studies have been published on retinal vein occlusion in type 2 and type 1 people with diabetes who have uncontrolled diabetes. They had severe dehydration and they still insisted that they want to fast. So if you have uncontrolled diabetes, you are not drinking enough water, you are not taking all the precautions to keep yourself well hydrated, that dehydration with hyperglycemia, with increased thirst, with increased urination will definitely lead to thrombosis. So that is why dehydration thrombosis is very serious complication. Our advice to all our people with diabetes before Ramadan is to drink a lot of water before Ramadan starts so their body does not show the signs of dehydration. And the most fearsome in type 1 diabetics is diabetic ketoacidosis, where we all know that when the blood glucose goes above 250 milligram, ketosis starts. And when it is above 300, then diabetic ketoacidosis starts. So summer fasting up to 20 hours per day, often in hot and humid conditions, can exacerbate diabetic ketoacidosis, dehydration. The other effects are, of course, on the body weight. There are effects on the lipid profiles, both favorable and unfavorable. There are other effects like dehydration, as I've already said. The EPIDIA study, which is again one of the biggest Ramadan studies in the Muslim population, they have shown that type 1 and type 2 usually does not show any change in their weight. Uh, More is more towards weight gain rather than weight loss. And if there is a significant weight loss during the fasting of Ramadan, it could be because of uncontrolled diabetes. So if as a physician, we have to look at the factors for risk quantification, what will those factors be? Type of diabetes, patient medications. Again, medications play a vital role. I will discuss later on. Individual hypoglycemic risk, presence of complication, which and comorbidities. If your patient has type 2 diabetes with cardiovascular risk factors and they have just had an angina attack or they have advanced cardiovascular disease, they should not be fasting. And of course, individual social and work circumstances and the previous Ramadan experience. So those of type 2s or type 1s who fasted last Ramadan, we can sit and discuss what they did and how well their Ramadan went. So these are the points that we need to keep in consideration while we are training, educating our people with diabetes for the upcoming Ramadan. Recognize factors that influence the fasting during Ramadan. I have already discussed with all of these with you. This is again just a repetition. that the length of the hours, the season of fasting, the weather, the social changes, especially now in COVID, the social changes really matter a lot. The past experiences, the type of diabetes, duration, if it is long duration, chronic diabetes, more complications, if they have retinopathy, if they have nephropathy, if they have cardiovascular risk factors, again, they are high risk. What are the anti-diabetic therapies they are taking? We will talk about that. They are either they are prone to hypo or they have hypo unawareness, and if they have rapid access to care. Individually, age, elderly should not fast. Females with pregnancy and lactation should not fast. Occupation, outdoor labor work, people should not fast. Meal patterns, exercise, heavy exercise should not be done during the daytime at the time of fasting. We change the exercise pattern after iftar, how motivated your person is to fast, and of course, the personal preferences. EPIDIA study has really looked into severe hypoglycemia and hyperglycemia, and we have seen that hypoglycemia during Ramadan was 7.5 times more as compared to the hyperglycemia. Okay. Can I just ask everyone to mute your, can you kindly mute your microphones? Thank you. What are the clinical recommendations to avoid hypoglycemia? Now, these are all practical recommendations. You always advise the person with diabetes to take suhoor very close when suhoor time is ending. Some people have a habit of eating at around 12 or 1 a.m. Suhoor is ending around 3:30 and 4 a.m., but they want to sleep. So they say, oh, let me eat now and go to sleep. This is very dangerous. The people with diabetes should always eat before the suhoor time is about to close. This helps a lot with avoiding hypoglycemia. Then their calorie intake should be matched before Ramadan calories, so they should not be decreasing or increasing a lot of calorie intake during Ramadan. And we all know, those of us who observe the fasting of Ramadan, unfortunately, the month of Ramadan is for fasting. We do feasting. Our iftar time is full of feast. There are 6-7 dishes that we are doing. So we are feasting. So we are consuming more calories during Ramadan than the normal days. Change the schedule and composition of meals. Now here, the most practical tip you can give to your person with diabetes is that they should take more protein and high fiber at suhoor time. More protein, high fiber. First, their glycemic index is less. Second, they will be feeling more full. Third, their feeling of hypoglycemia will be decreased. So we always encourage our people with diabetes to take more protein and high fiber in any form at suhoor time. And of course, they have to reduce the physical activity during daytime in order to avoid low sugar attack. How can we do all this? All of this is possible. People think, oh, it is very difficult. This is too much time consuming. It is not. If we plan ahead of Ramadan for our people with diabetes, we can do the risk quantification 3 months earlier. We can ask them to monitor their blood glucose and bring in the chart. We can advise them for more fluid intake and start taking small meals so that they start developing that habit of going into complete fasting. Exercise advice, medication adjustments, just 2 weeks before Ramadan, let's start adjusting their medications if we are adding a new drug. If we are not adding any new drug, then the medication adjustment will be on the last night of Shaban. This I'm going to explain later. and when to break the fast. This is extremely important. Most of the people with diabetes, because of their faith and their motivation to keep fast, if their sugars are going low early hours of the morning or in the mid afternoon, they will not break the fast. They will say, oh, I will go to sleep and let the time of iftar comes and I will not break my fast. I want to keep my fast. This is extremely dangerous, and we have to inform our people with diabetes that in Quran they say the people who are sick should not fast. So there is a leniency for people who are sick. If they cannot fast, there is nothing for them. It is not a rule for them that they should fast. If they are fasting out of their own motivation and goodwill, they have to keep in mind that they should not put their life in danger. Now, Ramadan education, that is 3 months or 2 months before Ramadan, is so important that this study have shown that the people who were given Ramadan education versus those who were not given Ramadan education, their level of hypo was much less as compared to the group who never received any Ramadan education, and they ended up having severe hypoglycemic attacks. How can we know the hypoglycemic events, and how can we ask our people with diabetes to fast safely? The key is blood sugar monitoring, SMBG, self-monitoring of blood glucose at home. This is the protocol that is recommended all over the world for people with diabetes to check their blood sugar in order to have a safe fasting. Now, pre-dawn, morning, midday, mid-afternoon, pre-sunset, 2 hours after iftar, and at any time of the day when they are not feeling well, they should check their blood sugar and they should break their fast. Another myth and the concept among people with diabetes fasting is that if I will check my blood sugar, I will be breaking my fast. They think that checking blood sugar is not allowed while fasting. All the medical specialists and the religious scholars have already given this fatwa that you can check your blood sugar and it does not impact on your fasting at any level. Now, for your people with diabetes who are using glucose sensors, it is extremely easy because they have a sensor. They can just trace their graphs on their machine, on their software, in their mobile. They don't have to prick again and again. But those who do not have a sensor, they have to check with the help of a glucometer, and they must check at least out of these six, they must check 4 times, depending on where they are feeling low or high, and then they should adjust their medication by discussing it with their doctors. So the first 10 days of Ramadan are very crucial for fine-tuning of the change doses, whether it's insulin or oral, that we do with our people with diabetes. So what will be the symptoms of hypo and hyper? Mind you, both of them are usually very similar. Sometimes people with diabetes cannot differentiate whether they're feeling low or whether this is high. So the only trick is to check their blood sugar. So if they have trembling of their hands, if they have sweating, they're feeling very cold, they have palpitation, their heartbeat is going very high, rapid, they're feeling extreme hunger, and their mental state is altering, like they're becoming extremely irritable and they're confused or they have severe headache. This is the sign of low sugar because the brain needs constant sugar supply. And the moment the sugar goes below 3.9, the brain starts giving you all these signs. And similarly, hyperglycemia is nausea, vomiting, especially in type 1, abdominal pain in type 1, and this frequent urination, extreme thirst are all the signs of hyperglycemia. This I have already shown you before, that the continuous glucose monitoring, this is an average scale which shows that after iftar, we have a severe spike of blood sugar reaching above 200 and 220, and this causes a lot of micro and macrovascular complications. So our targets as healthcare professionals is to develop the diabetes care team, healthcare support system via telephone, helpline service via Zoom, whatever. In COVID, everything is virtual now. So we can also do virtual workshops for a small number of people with diabetes in our clinics. We can do a group session and explain to them their risk stratifications. People with diabetes should be made aware via different pamphlets, different online social media activities, and via television and radio. And this goes the same for all the religious places where the scholars should address this point that people with chronic diseases must go to their doctors and get themselves assessed before starting Ramadan. The positive impacts of Ramadan focused education is greater glycemic control, better self-monitoring, sustained motivation, and greater empowerment. So again, the number of people who broke the fast due to hypoglycemia is around 65%. But if we give them proper education, this is going to reduce and people will have a better mental health. How would we adjust the diet and exercise? Now, here is the most important trick. If we understand the different macronutrient effect on glucose, high glycemic index carbs, we know that they give a bigger spike. So at iftar time, if we are eating high glycemic index carbohydrates, we are pushing our blood sugars very high. The low GI carbs, that is the low glycemic index carbohydrates, they flatten this peak. This peak is very dangerous for our micro and macrovascular complications. Proteins, when they are taken, they have a sustained release. They do not peak. And similarly, the fats. So that is why we encourage more proteins, a little of organic ghee or butter in the mornings with yogurt, with veggies, so that and high fiber bread if they want to eat, so that they have sustained release of glucose throughout fasting and not a very high. The dietary considerations, caffeine withdrawal. As I've already told you, this is one of the worst withdrawals in the first few days of Ramadan. So ask them to start changing their habit before Ramadan. Constipation, another big problem because of reduction in fluid, fiber, physical activity, caffeine intake. So again, we have to work around this, encourage them to take more fluid between iftar and suhoor time, do physical activity between after 2 hours or of iftar, and then of course they can do it after Taraweeh as well. Indigestion and heartburn is again because of too much fried foods, large meal within a short span of time, and eating meals just before going to bed. We understand that between iftar and sleeping time, there are only 4 to 5 hours. You have to sleep for 3 hours, get up again for suhoor time. So if you're eating just before going to bed, you will have indigestion, heartburn. And when you get up for suhoor, you don't feel like eating again. So you end up eating less, and you end up eating, having a severe hypo attack somewhere between midday to early, late evening. So these are the things that need to be individualized with people with diabetes. What are the recommendations that are given by the IDF-DAR 2021 guidelines? You have to divide it between suhoor and iftar, and you have to have 1 or 2 snacks in between. So the division of meals is that around 45 to 50% complex carbohydrates like barley, wheat, oats, millet, semolina, beans, lentils. 20 to 30% protein, and less than 35% fat, which is preferably mono or polyunsaturated fat. And then we have to have low glycemic index food like granary breads, multigrain breads, beans, and brown rice. We have to include a lot of veggies, fruits, and salads. Mind you, salads without mayonnaise, without dressings. The only dressing in salad that really helps us is the olive oil lemon dressing. That really helps us to keep our lipid profile in balance as well. The omega-3 should be taken more in order to decrease the triglycerides and the bad effect on cholesterol while we eat the high fried things. And omega-3 is very abundantly found in walnuts, almonds, pumpkin seeds. So we really encourage our people with diabetes as a snack, they should take walnut, almonds, pumpkin seeds. And in protein, in white meat, they should go for fish, which is again a good source of omega-3. Avoid sugary desserts, that is a high glycemic index. Those sweet things that we make as sweet dishes in Ramadan, and all the things in different cultures which are full of fat, full of sweets, they are high glycemic index. You can taste it with a half spoon, but you cannot exceed it. Again, small amounts of oils, and you keep yourself hydrated and avoid caffeine and other stuff. This is the example of iftar plate that we share with all our people with diabetes, and it gives a very balanced idea of how the iftar should look like. And we encourage to play around, change the items, but keep the portion of protein, fruits, veggies, oil as close to this plate as possible. Healthy snacks, as I said, making a fruit salad without adding sugar, any sugary syrups or anything, less amount of mango, less amount of grapes, can also be a very good snack for our people with diabetes. So already I have covered the 10 basic principles for the nutrition. It divide, educate protein, take sahur as late as possible, hydration, design meals with the plate method, avoid sugar heavy desserts, and all these things, which I repeatedly said is what we need to train our people with diabetes. Exercise rigorous. Those who are doing bodybuilding, weightlifting, they should not do it in Ramadan. They should cut it to a very lightweight exercise, everything after iftar. Or if you are performing Taraweeh in the mosque or at home completely, fully, that is your exercise. Then comes the medications. How are we going to play around with the medications? Metformin, you just need to keep metformin as it is, because metformin is a gold standard drug. And if your people with diabetes are only on metformin, keep the dose of metformin as it is between sahur and iftar. Risk of hypoglycemia, they have seen with the sulfonylureas, they have seen that the risk of hypoglycemia is different in different groups. So you have to look into the hypoglycemic effect, and you have to see that glycoside, there are a lot of studies which came on dimicron MR with dimicron, and they have shown that the glycoside is the long-acting sulfonylurea, which could be used safely in people with diabetes. Coming to DPP-4, the gliptins. In gliptins, when they compared it with sulfonylurea, they found that DPP-4 gave less hypoglycemic events and better glycemic control, neutral weight as compared to the sulfonylureas that were given in the month of Ramadan. And we all know the incretin effect of DPP-4 is on the intestines, where the incretin hormones act, and DPP-4 inhibitor prolongs the effect of insulin, which is being produced by the body. So if your person with diabetes is taking a DPP-4 drug, they are very safe to fast in the month of Ramadan. These are again studies showing about the DPP-4. These are the advantages of DPP-4 therapy during Ramadan, which is low risk of hypo, and they do not require dose titration. They are taken orally. They are independent of meals. That is very important, that they do not produce insulin. They do not have a direct effect on insulin production. Then comes SGLT2. There was a lot of controversy about SGLT2 drugs in Ramadan. Now, the guideline says that if you want to keep your person with diabetes on an SGLT2, which works on the kidney, and the patient has to pee a lot, and all the sugar goes out of the kidney to give you a better glycemic control, you should start SGLT2 at least 3 months prior to Ramadan. No drug should be added or changed just before Ramadan. This is the key for a successful practice with diabetic people, is no change before Ramadan immediately. Yes, 3 months early, you can do that. So if your people with diabetes are taking SGLT2 and they are stable, this was another study that came out on, which was called the Kratos study, and they looked into it and they saw that the rate of hypoglycemia with SGLT2 was markedly decreased as compared to sulfonylureas. Now, that was the oral incretin, which was a DPP-4. What about the injectable incretin, which is a GLP-1? Again, we see a lot of our people with diabetes taking once weekly GLP injection, or they are taking a daily GLP injection. So Treat for Ramadan trial looked into the efficacy and safety of liraglutide, which is a GLP-1, comparing to sulfonylurea, and they found out that liraglutide is very safe to be used in the month of Ramadan. Then there was Lira Ramadan study, which looked into individual effect of liraglutide, and they again found out that people who were on liraglutide had less hypoglycemic episodes. So in general, we can say that GLP-1 receptor agonists during Ramadan give you the low risk of hypo, effective in reducing HbA1c levels, effective in reducing weight. We have another drug in the market with the name of Zultafy 100 3.6. Now, Zultafy 100 3.6 is a combination of an ultra long-acting basal insulin along with a GLP-1. And there are no studies yet done on Zultafy in Ramadan, but if we divide the two ingredients, which is a deglutec, ultra long-acting insulin, there are studies done on deglutec in Ramadan, and they found it to be very effective. And then there are studies, Lira Ramadan and Treat for, on liraglutide that has been done. So Lira and deglutec are very safe. Combining them together in Zultafy, how much safe they will be, we have yet to see till next Ramadan. Medical supervision while fasting is extremely important in insulin therapy. And here I'm not going to go in detail. People on premixed insulins twice daily, they have to decrease their sahur dose, and then the next 10 days slowly up titrate or down titrate as per the SMBG. So these are the guidelines algorithm for people who are either on a basal bolus insulin, which means they take one time long acting insulin, that we reduce around 35%, and it is near the iftar time. And the bolus insulin, which could be Epidra, Novolog, or Humalog, we again go as per the carb counting guesstimation for the pump people on insulin pump, people on basal bolus therapy. However, those who are on mixed insulin, 50-50, 60-40, 30-40, it is to individualize with their physicians how much will they take at sahur time, how much they will take at iftar time. So this is a algorithm where if you are below 70 and you are having hypo, you reduce 4 units. If you are between 70 to 90, reduce 2 units. 126 to 200, increase by 2 units. Above 200, increase by 4 units. So this is a general guideline we give to our people with diabetes. So in the end, I would just like to again emphasize that fasting in Ramadan is not only the Ramadan time. We have to be, as physicians, proactive. We have to go before Ramadan, 3 months before Ramadan, to do our risk categorization, individual planning, advice on self-management. During Ramadan, we have to stay in close contact, either through telephone, through fax, through SMBG, through their graphs, which they are using if they're using sensors. So we keep on doing their fine-tuning of insulin or oral on the basis of self-monitoring blood glucose or sensors. And of course, after Ramadan is something we always forget. After Ramadan, we must do a post-Ramadan follow-up where we again bring them back to their old regimen, which was before Ramadan. We could change the drug, we could change the dose. So we must let them understand that they themselves cannot go back to their original pre-Ramadan dose. They have to come back to the clinic, discuss with the physician, and get everything adjusted. And I think, yeah, this is my last slide. And I really thank all of you for your time. And it's open for question and answers if you would like to ask anything.
All right, thank you, Dr. Fauzia. I'm just going to open it up for questions. If you want to use the chat box, you can use the chat box as well, and we can read out your questions if you have any.
I have tried to cover all the basic information which is required for us to give the best information to our people with diabetes. So I hope that things were clear. And if you have any kind of question, you are most welcome.
Or any remarks, any?
Pregnant, yeah, there is one question. Pregnant.
Okay, hi, Dr. Fauzia.
Hi.
That was a great presentation, thank you. So just one quick question, actually. So if somebody is a diabetic and let's say now after iftar, is there a recommendation on how much to eat like right away? Or they can slowly
that's a good
increase
question.
their meals? Because
that's a wonderful question. Thank you for asking. Okay. When they want to iftar, because they have to take their medication, if they are on insulin, they have to take their insulin. So what we usually recommend is they can take 2 small dates. Each small date is by guesstimation around 15 grams of carbohydrate, and it has got fiber in it as well. And the dates should not be dipped in the sugary syrup. See, we have so much variety of dates. A simple date, small in size, they can take one is preferably 1 date, a glass of water, or a glass of milk, cold milk, or whatever they prefer, or a cup of soup, hot soup. And then they can go perform their prayers after iftar, come back and have that iftar plate. And then they go for Tarawih, which is after around 2 hours, 1.5 hours to 2 hours, have a Tarawih, come back, have their dinner. Some people don't like to do that. Some people would like to eat dinner directly at iftar time. And after Tarawih, they like to take some snacks, which is also very good. But eating to the fullest and eating full is not recommended, because that makes your stomach so tired. There is so much lethargy that even praying Tarawih becomes so difficult. I have seen people saying that when we are praying, we are half asleep. We want to sleep. And I said, because you ate so much.
Yeah. Okay.
Yes.
Okay.
So eating is like grazing. You graze, you eat slowly and take your time. Do not eat fast, and do not eat and do not drink a lot of water immediately after breaking the fast.
Okay, thank you.
Thank you.
There was a comment in the chat about being pregnant. So I think what Safa is talking about is, can you fast if you're pregnant but not diabetic? Is that right, Safa? Or if you can clarify your question.
Yeah, that's my question. Like, because this long time, firstly, thank you for the good presentation. If the lady is pregnant during like this long summer, So is she still can fast or not, according to, but she is
Well,
not diabetic.
she is not diabetic. Then again, it is individualization. Their gynecologist will see if she has some other risk factors in pregnancy, like she is hypertensive, or she has thyroid issues, or she has other problems. If there is no problem, pregnant females actually are exempted from fasting. They should not fast because they have to eat for two persons, and if they are going into a state of starvation, that leads to ketosis, and ketosis is so dangerous for the fetus, whether they are pregnant or whether they are diabetic or they are non-diabetic. Pregnant females are more prone to ketosis on long starvation. So if it is 20 hours to 18 hours fasting, there is starvation. If they really want to fast, we recommend they do fasting for 1 or 2 days, take a break for a few days, and then fast again. This is what we recommend for our type 2 diabetics who continuously insist. So instead of us saying no and they still go and do it, what we suggest is kindly fast for Thursday, Friday, and then do not fast for another 3-4 days, so that your body recoups properly, and then you can go ahead and fast for again 2 to 3 days. I hope I answered your question.
Yes, thank you. Yes, that's great. Thank you.
Thank you, Safa.
And
Shahram is asking a question, I think, yeah? Yes, Shahram?
Yes, thank you, Dr. Moyeen. That was very perfect lecture.
Thank you.
Actually, I want to ask you a question related to those guys on insulin. And you mentioned that you can, measure BGL before iftar and before suhoor in order to change probably the units.
Mm-hmm.
So, but in Alberta or generally in Canada, the interval between iftar and suhoor is really, short. So, do you think it's reliable? Those, numbers we get from pre-iftar and pre-suhoor, because if the patients take the insulin, how can adjust the doses related
Thank
to
you.
this gap?
Okay, thank you so much. This is a very relevant question. I think with the basal insulin on board, that solves the problem quite a bit. Quite a bit, yeah, because the deglutec, which is the ultra long acting insulin, is effective till 42 hours. So if the person is on insulin long acting, and then we give them the bolus insulin at suhoor and iftar, I think that will be the safest way of taking our people with diabetes on insulin in the month of Ramadan. However, if they are on pre-mixed insulins, you are very right that the 20 hours and all that could become a little challenging. But again, we have to check the SMBGs and then see which insulin or how the dose can be managed, because usually the 70-30 combination still works in people with diabetes in long hours of fasting, as per my experience. We advise them to take insulin very close to the ending of suhoor time, and we advise them to check their sugar before iftar and inject insulin, and then immediately take iftar, or open their iftar and then take insulin if their sugars are going low. So there are so many individual possibilities that can be taken into consideration. But I have found the basal bolus insulin therapy a wonderful therapy in Ramadan.
Thank you so much. Much appreciated.
Thank you. Thank you.
okay, we have a couple minutes if anybody has any, last remark or questions. Yeah, go ahead, Ghada.
Yes, thank you so much, Dr. Fauzia. It was so informative, and your background obviously helps.
Thank you.
Oh, you're muted again.
You were mentioning taking one date with some soup and then going to prayers and coming back. Are you recommending this to diabetics or to everyone in general? Because Sunnah is 7 days, so I'm wondering what is the right thing to do.
Well, the Sunnah is odd numbers: 1, 3, and 5, and 7. So I would rather stick with the 1 for people with diabetes, but the people who do not have diabetes can go to 3 dates. So the Sunnah is 1 date, all the odd numbers: 1, 3, 5, 7, if I am not wrong.
Probably you're more accurate than the information I have. So for non-diabetics, you'd recommend with 3.
The non-diabetics, again,
3
yeah, the 3 would be reasonable. Again, I would say with the era of diabesity and with the genetic predisposition of type 2 diabetes, I think, and also the genetic and the race, I think we all are very highly susceptible to have type 2 diabetes. So most of us, if we do not take the precautions, our family members, elder family members, our parents have type 2 diabetes, I think we should look for a more healthy lifestyle and look into more healthy eating rather than going into abrupt heavy eating, because again, as I said, Ramadan is a month of fasting, not feasting.
I totally agree. We should be proactive in staying healthy. Totally
yeah
agree. Thank you so much. That's very helpful.
You're most welcome. I think we should take this opportunity of the month of Ramadan to practice healthy eating instead of making a whole list, a menu list of what and how many things to be cooked in iftar. So instead of that, let's try to revive for 1 month how to eat healthy. So as this is a month of detoxification for the body, fasting is detoxification of your body, what we have eaten for the last 11 months. The month of Ramadan cleans the body completely. So let's do the cleansing process properly with light, healthy meal. We feel light, we feel energetic, so we can pray, we can meditate the requirements of this month even much better with a very fresh mindfulness. So these are the things I think we should really start planning.
Okay, thank you so much. Thank you so much.
Thank you. Thank you.
Okay, we'll take Sandra's question next.
Thank you so much, Dr. Fauzia.
Thank you.
I know you had mentioned something about avoiding excessive exercises during Ramadan. So if a patient were to ask us, what can I do in terms of exercise? What advice would we give? Like, what kind of exercises would you recommend? Walks for how long? What kind of walks? Stuff like that.
Thank you. Thank you. That's a very practical question. Thank you very much. For people, usually, as I said, if they are praying Taraweeh and they are praying complete Taraweeh, that is a physical activity. So they really don't have to do anything else. But those who sit and pray Taraweeh, they cannot stand for longer periods of time. We encourage them that after their meal, after an hour and a half or 2 hours after meal, they should at least go for a walk, depending on how fast and how easy they are in walking. We do not say go for brisk walk. We say walk for 10, 15, 20 minutes as your body is comfortable, because if they will continuously do it every day, their body will get used to it and they will slowly and gradually increase their time up to 20 minutes. 20 minutes exercise or swimming, light exercises, aerobic exercises that do not cause too much burning, like the weightlifting. As I said, those people who are doing gym, we do not encourage them to do the gym during daytime because it causes insensible water loss, it causes a lot of thirst, it causes dehydration. That again can lead to a lot of other complications, because type 2 diabetes is a state of inflammation in the body. So we really need to make sure that we advise them to do healthy lifestyle, to observe everything that will lead them to a healthier side rather than to problematic side. Okay, thank you, Sandra.
Thank you.
Okay, all right, everyone. I think this brings us to the end of our session today. So I just want to thank Dr. Fauzia for taking time out to come and deliver this very informative presentation about diabetes and Ramadan. And I think you said something very important in this presentation, that Ramadan is about fasting, not feasting. And that's something that we often forget with all the yummy snacks and the fried food. So it's very important to, be mindful about what we're consuming and the level of physical activity that we're integrating into our daily life, especially in the month of Ramadan. So thank you, Dr. Fauzia. Yeah, on behalf of all the members who are here today.
Once again, thank you very much, everyone, for staying with us for more than an hour. Thank you, Emga. Thank you, Dietary, for always being there to let us come and share our experience with our colleagues. So I wish you all a very blessed and a very happy Ramadan as well.
Thank you so much. Thank you, everyone, for joining the session today, and have a great rest of your evening.
Thank you so much.
Thank you.
Thank you.